Good morning, everybody. Thanks for joining us. As some of you might know, I'm Tony from McLaren St. Luke's Family Medicine, and as we do the third Wednesday of each month, give a talk on a different medical topic. And today we're going to talk about taking care of our skin. I don't know where the men are at because men have skin as well, but we're welcomed by the women, and that's okay. You know, as we get older, we start to see a lot of changes in our body, and one of the things is certainly our skin. And then we say to ourselves, oh my gosh, is that an age spot? Is this cancer? Is this something that is normal? Is this something that I need to be checking with my doctor? Or just simple things like, hey, I have dry skin now. Is it because we're starting to turn the heat on in the house? Is it because, you know, we don't have around as much humidity? Is it because of medications I'm taking or something else? And if it is dry skin, do I need a medicated something, a prescription from my physician, or do I need an over-the-counter type of lotion? So today we have Dr. Alita Lishi, who's going to be sharing a lot of that information with you. So I'm going to turn it over to her, and then we'll stick around in case you have any personal questions.
Hi, you guys. I'm Dr. Lishi. I'm a family medicine resident from McLaren St. Luke. As Tony said. So basically, we're talking about skin today. Skin is the largest organ in our body. You may already know this. It has several layers thick. It's not just one cell layer, but there's different layers of your skin with multiple cells in it. Melanin is a cell that gives your skin color. It provides protection. Some areas are thicker than others that provide more protection, like our hands and our feet. Other thinner layers that aren't called skin, but mucosa don't have as many layers, like in your mouth and other areas. It can serve as warning signs to disease. It can break into the body temperature, help bones stay strong by making vitamin D with the sun. And it changes as we age. The changes are we have less moisture, it gets thinner, less elastic, and you can get easier bruising because of that decreased elasticity and thickness of the skin. Some common conditions you guys know about and probably have experienced. Dry skin. Avoid hot water, long baths, drying soap. You want to apply lotion right after drying your skin after a shower or washing your hands. Keep it moist. If your dry skin that you've noticed and you're using over-the-counter things, if it doesn't improve or worsens, you can ask your doctor about it. There's normal things like nevi or moles. We can get more as we age, different age spots, different patches of skin that are a little darker. There can be precancerous growth that occur too. We can have wrinkles, age spots. Sometimes if your skin's thin and you pump it, because of different medications and things, you can get bleeding, you can get growth, sores that don't heal, and roughness to areas that feels like sandpaper. We can also, you know, our scalp is also skin. People don't think about that. We can get dandruff or seborrheic dermatitis. We can get contact dermatitis. Some people, if they touch latex or certain soaps or different things, can have a sensitivity reaction to that. Seborrheic keratosis is like thickening of your skin in an area. You get more of these as you get older or age. They are the spots that are usually rough. They'll sometimes look waxy or look like they're stuck on, usually benign. The things that we're wanting to look for or watch for is skin cancer. The most common cancer in the United States is skin cancer. Sun, UV radiation, and exposure to the sun is the most common cause. 1 million a year develop skin cancer by age 65. Basal cell is the most common. You've probably heard of that. About 8 out of 10 people have that. And most of the time it's benign, or if it isn't benign, it doesn't spread fast. Squamous cell carcinoma is the second most common. And melanoma is least common, however, it's the most dangerous. So things we can do, if you're a smoker, definitely recommend stop smoking. Not good for organs in your body or outside of your body. You're, definitely not good for your skin. You definitely want to get regular skin exams by yourself and your doctor. Don't forget to check your feet and your scalp. You can use a blow dryer to move this hair out of the way to check your scalp. Things that you're looking for, the most concerning thing is melanoma. So how we look for melanoma is by looking for the A, B, C, D, E. And there's pictures on there. The A is for asymmetry. It doesn't look the same on both sides. Borders, if they're blurred or jagged or rough, and they're not a smooth border, that's not good. You definitely want a smooth, regular border. Color, you want one color. If there's a change in color or there's different colors within the spot, that can be concerning. The diameter of it, if it's larger than a pencil size, like a pencil eraser size, then that can be concerning, especially if it's getting larger or changing. Sometimes we have moles or spots or nevi that we've had for a long time, and they may be larger, and your doctor may have looked at it and said that's benign and normal, and if it doesn't change, that can be okay. You want to report any changes in the moles or spots to your doctor. If you've had any skin cancer in the past, if you have a family history of skin cancer, their skin can be more sensitive to sun and spots too. You definitely, want to get checked by your doctor. Regular doctor visits, usually once a year, they might check your skin. Sometimes for some people, if you have concerning areas, you may be referred to a dermatologist or something that's more specialized to check those spots. You want to wear protective clothing to prevent sun exposure. Wear sunscreen and avoid the sun between 10 a.m. and 4 p.m. So how we care for our skin, we want to help keep it moist. We don't want it to dry out too much. So whatever cleanser you use, you want it to be a mild cleanser. I have a picture of some over-the-counter decent quality cleansers. You don't have to use these. There are other things you can use too. You want to avoid things with high fragrance, things that are really abrasive or have a lot of there's all those things with all those little scratchy things. I can't even think of the word, but some of them are pretty rough. Definitely want something more gentle and mild to clean the skin. You want to make sure you rinse whatever cleaner off very well, because if you leave it on there, that can actually irritate it too, even if it's a gentle cleanser. You want to pat your towel dry. They say not to rub it really hard. And you want to moisturize. You want to use a good moisturizer. There are some examples of over-the-counter ones that are a better quality than some of the others. You want to avoid, again, just like with your cleansers, you want to avoid a lot of fragrances or different chemicals in there if you can. The reason we want to use a moisturizer is to create a seal on our skin to help hold it, the moisture, so we don't lose that. And the skin doesn't dry out as much. There are ointments and creams and lotions. The ointment will create a better feel. Usually they're a little more expensive too. But you can use a cream or lotion, and that can be sufficient as long as your skin isn't dry and it feels okay. If you ever use a product, or if you already have an area that's red, irritated, or and not going away, you can stop whatever product you're using. if you weren't using a product and you had an area that was irritated, dry, if you can try keeping that area clean and using a lotion. And if it doesn't go away, you want to follow up with your doctor, check it out. So sunscreen. So it's really cool because a lot of the new shirts they have now are actually sunscreen protection. I actually wear those all the time, year round. I'm a sensitive skin person. But some of the shirts you wear actually have like 50 SPF or whatnot. Before going outside, and a lot of people don't think about cloudy days. If you can see outside and there's light, you're still getting sun exposure. So you do want to have sunscreen on your face. You want to use something that's less greasy, like there's a Neutrogena face sunscreen that's actually pretty nice. It's pretty smooth and it's not too oily or greasy. And you want to use 30 SPF or higher. SPF is the amount of protection that it has. It's like 30 times the amount of protection you would have versus having no sunscreen on at all. You want to apply it 20 minutes before you are exposed to the sun and reapply every couple hours, especially if you're sweating or in the water or something like that. That's what I've got. Do you guys have any questions at all?
Are there any over-the-counter things that would be good for those, the keratosis, another one that's more common?
Yeah, so yeah, for those, there's not something over the counter that's going to get rid of those. Those you just want to keep them moist, just like you would the rest of your skin, and treat it like the rest of your skin. They're a hardened, kind of buildup of keratin. They're not pretty and they're not fun. The doctors, they can cut it off.
It's hard not to pick it up.
Well, yeah, I mean, people pick at them all the time. I don't think that's
I don't
problem,
know, but
but if it is changing or there's certain things, get to mention, just hey, just check these out. They'll probably say, oh yeah, that's what that is. And if it is something that bothers you, you can have them remove like different spots. Sometimes there's concerning spots that are, they do want to biopsy or look at. Also, like even the skin tags can be painful depending on where it is. You can have those removed, things like that, and those can be completely benign or non-cancerous too. So, yeah,
now what about using duct tape for removing wood?
it's a good thing.
Because that works.
Yeah, you can. There's like over-the-counter salicylic acid or
Yeah.
different things like that. You can use that. You could also put duct tape too, and make sure it's clean it out.
Would that work with skin tag?
No,
No.
not that I know of. But yeah, no, definitely the duct tape works for the worst. Like definitely heard that, and actually spoke people to do that before. Yeah, and if you have something that's stubborn and not going away, like a thyroid or something like that, you definitely want to bring that up. And sometimes in the office, they'll brief them or do different things with that. Good questions. Any other questions? Mhm.
I don't know if it's a question, but I do take hot showers.
Mhm.
I like them.
I do too.
And my skin does get dry.
Mhm.
And if I remember, I put moisture, but most of the time, because I can't even, I put it today because I was coming to this, so we need to put moisture when it's dry, so I did. But it's the corner of my eyebrow here that gets really dry, just a piece. Is this part of the same thing or is something I should be more
So
concerned about? It gets really, really dry, just the corner.
So there's a couple things there. So when the really hot showers, if you do take really hot showers, after you dry it, because like sometimes you dry, get dressed, whatever, before you even get dressed, put lotion on to help, because even though that hot water is still, your skin's moist, more moist then than it will be. And if you let it dry, it'll dry faster. And yeah, so I would just definitely put moisturizer.
I'm not running, but yes, I tried to.
Yeah, just, at
I'm
least
sure we're getting dressed and out the door.
yeah, so just, just have it on your counter or wherever, easy to access so that you put it
I
on.
was
the
wondering what is that spot in particular?
I don't know. There, it could be a number of reasons. It could just be eczema, it could be a reaction to something, it could just be a dry spot. If it's not going away and you're concerned, you should ask your doctor about that. Okay, but yeah, most likely it's something very common, like eczema or just, some people have psoriasis or dry skin conditions.
Well, I know I have it in my leg. They're itchy and sometimes they hurt.
Yeah,
But I had that for a while and, my doctor had told me to use a better over the counter.
Yeah. and the
Moisturize,
ones
yeah.
that are on here are some better.
Well,
over
every
the
time
counter
I
ones.
use her,
That one's a good one.
yeah, which is.
Yeah, the
nice.
CeraVe, I think it's a little more expensive. That one's supposed to be better. There's some different ones that are good. Yeah. Hopefully it's helping.
Yes, it does when I put it in.
Okay. Thank you.
I already figured out that it's not just buying it. But it,
Yeah, you know,
If you use
it
it.
does work better that way.
yes,
I think it's important.
I have one more question. I have a friend that showers. Now, she's not here, so she can't defend herself. Showers every day, and her feet crack, her fingers crack, and I keep telling her she probably shouldn't, but she's not gonna change that. She's bound to tell me she doesn't shower
Some
every day.
people can tolerate more showers better than others. Some people naturally have drier skin and they're more prone to cracks and things. So, if she had, if her doctor sees her and knows that she just has this going on.
Yeah,
Yeah, there's different creams and,
she puts stuff
Lotion.
on, but, she hadn't played by it, so.
yeah.
Right.
Yeah, that's,
Yeah, that's a tricky one.
Yeah.
Yeah.
any other questions at all?
Well, thank you
Thank
for
you.
joining us. Next month, I will be giving a talk on sleep disturbances, so hopefully get a chance to see some of the same faces. In the meantime, wish you a happy Thanksgiving and stay warm, because from what I saw on the forecast, things are gonna change from last week.
But Thanksgiving looks good.
There you go.
Okay.